Next and last thing in that figure I need to understand is I-square value. Now, I-square value represents the heterogeneity between those studies. What does that mean? The heterogeneity. Okay, so heterogeneity means how different or how similar the results of the included studies are. So here, for example, let's look at the first study. The first study shows that the ADG has lower value compared to biomass. The second study shows that ADG has a higher value compared to biomass. The third study shows that basically they are the same. And the overall outcome, there is no significant difference in those three studies. So the heterogeneity here represents how different those results are. So as you can see from those studies, each study has a different result. The first one is lower, the second one is higher, the third one, they are the same. So the results are not exactly the same. And that's why I have 43%. So the heterogeneity can go from 0, means like those results are basically the same from all the included studies, up to 100%, which means the results of the included studies are very, very different. So here they are different, but their end result is that there is no significant difference. Those three studies show no significant difference, and that's why it's 43 and not more than 43. Because the included studies show different results, but in the end, they show that there is no significant difference. Each study showed no significant difference. Now let's go to this. Why do I have here 86%? Why it's higher this time? So if I look here, I have 43. Here I have 86. Why? Please try to think and let me know. Because exactly, thank you. Yeah, very good. Because one study actually of those three studies showed that it shows that there is significant difference. The other study showed that they're basically almost the same. The third study showed that this one, the ADG, is more than biomass, but no significant difference. So here the results are even more and more different. So as you can see, those are different, but they show that there is no significant difference. So they have different numbers, but overall no significant difference. Here, they have different numbers, but even one study shows that there is significant difference. So that is why I have even higher nitrogen. Is that clear? Okay, I hope so. Very nice. All right. So again, what is the final conclusion from this meta-analysis? No significant difference. So again, here it means that ADG and BioOS have the same performance, same clinical outcome when it comes to secondary implant stability, which is when I measure after some time. All right. Now here is just a forest plot with the risk ratio. The risk ratio, or basically even if it's the odds ratio. Now let's look at the line of no effect. Which number does it go through? Number one. Now here it doesn't go through 0 like the first one, like here when I have mean and standard deviation. Why is that? You should know this actually. I should not really explain this, but I'm just reminding you. No, okay, because actually, if you remember your statistics classes, when I have an odds ratio or risk ratio of 1, this means that there is no significant difference. Because when you multiply anything by 1, any odds ratio or risk ratio by 1, this means no significant difference. So just remember, just keep it in mind, when you have meta-analysis using like the mean and standard deviation, the line of no effect would be at 0. When we have odds and risk ratio, the line of no effect would be at 1. Now, just to get back to your question, here, as I said, the events and total of the study and the control group, when I calculate the risk ratio, I will just divide 1, for example, divided by 53. But when I want to calculate the odds ratio, I divide 1 by 52. It means so either the events divided by total or the events divided by the rest of the sample. So basically, they all comes down to the same thing, but it's just how I calculate those things. All right. Next thing before we go to the activities is the subgroups. Now, sometimes the studies that I include in my systematic review and meta-analysis lead to the same outcome. They measure the same outcome, but they have slight variations in between those studies. For example, they can have different study design. Or, for example, they can have different follow-up period. Like I have 5 studies reported the percentage of bone formation at 3 months, and 5 studies reported the percentage of bone formation at 4 months. So they're all reporting the percentage of bone formation, but at a different time period. So I can include those studies all together to get the final result, but I can also divide them into what I call subgroup to get each result from the very, very similar studies. So I can say, okay, as we saw here, for example, the next example, sorry, is the different concentration. So for example, those studies use the drug at 1 milligram per ml, but those studies use the drug at 2 milligram per ml. But overall, they're measuring the same thing. So I can make this meta-analysis, but I can also divide into subgroups to get the result of studies that are very, very similar. Okay? So overall, they're measuring the same thing, but if they have slight variations, I can divide them into 1, 2 subgroups, and I can get also the final outcome from all studies together. Now, as you can see here, I divided studies into studies with simple extraction and studies that had simple and surgical tooth extraction together. So here I divided into subgroups to get the result of each subgroup, and I got the final result of the meta-analysis. So this is just to explain subgroups. Okay, now here again, another subgroup. I divided studies with the meta-analysis to studies with on patients with antiplatelets and studies with patients on anticoagulants, just to show the results when patients are taking different drugs, basically. So this is just a slight variation. Now, going back to this forest plot here, what is the final conclusion from this meta-analysis? Is there a significant difference? Yes or no? Yes, very good. Because that green or black diamond or whatever doesn't touch the line of no effect, which means, and here it is to the lower side, which means that hemostatic agents have significantly fewer bleeding events, which means cases with bleeding compared to the control methods or to the conventional methods. Okay, so this is how I get the final conclusion from the meta-analysis. And as you can see here, the value is 0.007, which again means there is a significant difference. All right, now moving to our exercises and how we present those results. So how do I present and understand the result of the meta-analysis? First of all, I would mention the total number of the included studies. So I will say 10 studies were included in the meta-analysis, or 10 studies underwent the meta-analysis. Next, I would mention the number, the heterogeneity that I can see. I would say here there was no evidence of heterogeneity or no heterogeneity was found or something like that. After that, I will say the number of the included patients from all studies. So we have 541 included in the hemostatic agents group and 551 included in the control group. Then I would say the bleeding events. So how many cases with bleeding happened from all studies in the hemostatic agents, and how many cases with bleeding happened in the control group. And of course, the final and the most important thing is that I will say the total or the final result of the meta-analysis. So the meta-analysis showed that there is a significant difference or significantly fewer bleeding events in the hemostatic agent group compared to the conventional methods. And I will write the results of the meta-analysis and the p-value. Okay, so first we start how many studies were included, the number of patients, and the number of events, and of course the number or the final result of the meta-analysis.